LiberalViewer presents.
So, welcome to the April 12th edition of LiberalViewer Sunday Live Clip Roundup. Thanks for joining me. Happy Easter, Passover, soon to be Ramadan, something else or nothing, depending on what it is you celebrate. This week I have the 12 best, most newsworthy clips that I picked out from the Sunday morning news analysis shows from the big five corporate outlets of ABC, NBC, CBS, CNN, and Fox News, the so-called corporate media here in the United States, for what should be a really informative, educational, fair use media criticism and political commentary show for you all tonight. Down in the video description, I dropped my clip list. Is this my clip list? Nope, that's not my clip list. This is my clip list. Down in the video description, you can see a link to my clip list. You can follow along on my notes that I use for the 12 clips and the 2 still images that I'll be showing you for my live stream broadcast. The 2 still images actually represent the 2 main parts of the topic. There's a backward-looking topic from this breaking New York Times story this morning. I put a link to the New York Times story in the video description about how Trump ignored all these warnings of the coming pandemic crisis that we're all in now. And then there's the forward-looking topic that I, more forward-looking, used as the title for my video, the COVID-19 crisis peaking, ? And, last week I told you about glimmers of hope from Andrew Cuomo's press conferences about cases in New York possibly peaking, and that they had finally gotten to the worst part of the epidemic. And that may be true, but this week I'm also going to, let me show you. First I was talking about that New York Times story. I forgot here is one of the still images. I forgot let's see. Now can you hear me? So this is one of the still images I have for you. He could have seen what was coming behind Trump's failure on the virus. So that's the backwards looking story I was talking about. And then the forwards looking story, even though there are the conventional wisdom this week now definitely seems to be that we're at the peak, and it could be like a plateau for a while. And it's based on continuing social distancing and all these strict measures all the way through May, which Trump may not want to do, and that's going to come up in the news summaries. But I saw this interesting forecast that I haven't really looked into what's behind it from Morgan Stanley, of all places. I saw this tweeted, and you can see a link to the Financial Times reporter who tweeted out this image. This is the forward-looking image, and there I got the audio turned on from that. And it shows this first arrow all the way to the left there is pointing to where we are right now, which seems to be a peak. But it's just the coastal peak. And according to this model, there's the rest of the United States is going to peak later, which will be the actual complete peak. And there's all sorts of interesting information, as to when various things are going to happen. And it goes all the way through next fall, where there might even be a new outbreak if you look at that. And and that's something I'm going to discuss when I go through some of the newsmaker and news summary clips. But I'll have Anthony Fauci talking about some of the problems in the past. I'll have Stephen Hahn, who is the commissioner of the FDA, the Food and Drug Administration, and Muriel Bowser. I'll have a clip of her saying that she thinks that the virus is going to peak. She's the mayor of Washington, D.C., and she's going to say that the virus is going to peak in Washington, D.C. in June, which kind of backs up that curve I just showed you. But first, I do want to show you a political comedy from last night. Saturday Night Live came back unexpectedly. All the stuff was done from home. Alec Baldwin called in as Donald Trump on Weekend Update, talking to Colin, Jost, and Michael Che, and I'm going to show you 2 minutes of that clip. The entire clip is down at a link in the video description, just like the source of all my clips. And what I liked about this is I've had to watch all of these Donald Trump press conferences. I watched them completely, totally, and it's been, as someone who's watched every single one of those Trump press conferences, please pity me. If you watched anywhere near as much of these god-awful spectacles as I have, the satire in Saturday Night Live captures some of the tropes in the press conferences, but it's almost beyond satire. And anyway, I'll discuss that with you after we watch 2 minutes of Alec Baldwin calling in to the at-home version of Saturday Night Live last night. We'll watch it together and talk about it after we watch it over here.
Yes, Mr. President. So what's the latest with the virus?
Well, I'm happy to report, Colin, that America is now number one in the world for coronavirus. Number one while I was president, hashtag America number one, hashtag not important why.
You seem almost excited about it.
Well, my approval rating is up. My TV ratings are through the roof. And every night at 7 p.m., all over New York claps and cheers for the great job I'm doing.
Yeah, I don't know if that's for you, man.
You're wrong, LeBron. You're wrong. I'll be honest. This virus, this COVID-19 is really a tough one.
What exactly is your advice? Because it seems to change every 24 hours.
That's a nasty question. You're very nasty. It's consistent all along. I've always said it was a giant hoax that we should take very seriously, even though it was invented by the Democrats. Impeach me, part 2. So everyone needs to wash their hands or not.
I was wondering, where are you getting most of your advice for this?
We have to listen to the experts on this one. Me, Hannity, Jared Kushner, and Mike Lindell from My Pillow. All the experts agree we need to wear masks.
Right. So are you wearing a mask?
That's a nasty question, okay? No, I am not. Last time I wore a mask, I hotboxed myself and passed out. And I can't wear a mask in my tanning bed or when I take it off. I'd be dark up top with a white circle around my mouth like a reverse Homer Simpson.
I don't know. I kind of like the reverse Homer Simpson joke, but if what they did there, I think they had other members of the cast and maybe the writers in the audio to provide the laughter of a studio audience, and I don't think it worked very well. That's why one of the things I wanted to see if you agree with me after watching that clip. I'm not sure I recognize. It sounded like maybe Adie Bryant or maybe it was Kate McKinnon was like the really loud female, like over laughing or giggling or whatever you want to call that. But I don't know. I thought that really distracted from the comedy, but it's a difficult position to be in, and we're all working through this pandemic crisis together, and Saturday Night Live is no different, I guess. And like I said, one of the things I did like about the skit that they had written there for Alec Baldwin was that he attacked the reporters, the way that Trump has been attacking the reporters, a nasty question when he gets asked a question. I mean, some of it is just ridiculous where he you should be asking that question in a way where you're saying how great a job, Mr. President, aren't you doing a great job on this? And why are you doing such a great job? Just like he didn't do a press conference today, I saw in the live comments, people were asking, this is like the one day he took off for Easter, I guess. We can thank Jesus for that maybe, but yesterday, or was it the day before, I saw him do a press conference where he went, it was the day before yesterday, where he talked about his constitutional authority in a way that made no sense if you've actually read your Constitution, and he went back and forth on it. He gave a lot of mixed messages, which that was also something Saturday Night Live picked up there. The mixed messages, that's been pretty heavy in the coverage I've shown you from the big 5 corporate outlets in the last few weeks. And now I want to get to the news summaries from all 5 of the corporate outlets, starting with NBC News' Meet the Press. Chuck Todd, I think, as usual, had the best of the news summaries. It's also the longest, and it gets to, it talks about the cautious optimism that I was talking about last week. This is the new conventional wisdom that I'm going to maybe question a little bit after I show the news. Oh, one thing I forgot to mention from the Trump press conference that I thought was most ridiculous, or not most ridiculous, but I almost used as my political comedy moment. One of the reporters asked, he's making, you'll see in the news coverage, he's about to make this big decision. Is he going to open up the country on May 1st, even though it's not even really up to him whether he opens up the country. It's mainly up to the governors. But when he makes this big decision, maybe the biggest decision of his life, he said, the reporter asked, what metrics are you going to use? And he said, I basically said, I got your metrics right here. I'm going to use the metrics right here. And that clip is in the NBC News Meet the Press news summary. This is about 4 minutes and 22 seconds, where Chuck Todd only says Happy Easter, Passover, not all the other things I said at the beginning of my live stream, which I will talk about with you a little more. Well, I'll talk about this whole clip with you a little more after we watch it together over here.
Good Sunday morning, and a happy Easter, and a happy Passover. It's hard to talk about good news when more than 2,000 people are dying on a daily basis in this country. But this past week, we did see some reasons for optimism. Very cautious optimism. As of this morning, there have been more than 500,000 confirmed cases of COVID-19 in the United States and more than 20,000 deaths. Both numbers, sadly, now lead the world. But the curve appears to be flattening as the pace of new cases has slowed and the rate of hospitalizations is down, all suggesting that eventually the rate of deaths will also slow. The New York Times has a deeply reported story that for weeks President Trump ignored repeated warnings from White House and other government officials, partly out of fear of hurting the economy and partly because he perhaps refused to accept what he was hearing. With nearly 17 million Americans filing new unemployment claims in the last 3 weeks, the president is eager to open the country again for business by May 1st. But getting back to normal depends on two big ifs. One is if we continue social distancing, which clearly is working, and if we are able to institute large-scale testing to see who has the disease, who's recovered, and do contact tracing. Maybe it's appropriate to wrap up the past week with a quote from Winston Churchill after British forces finally routed the Germans in Egypt in World War II. Churchill told his people, "Now this is not the end. It is not even the beginning of the end, but it is perhaps the end of the beginning."
I want to get it open as soon as we can. We have to get our country open.
As the president signals he wants the economy to reopen as soon as May 1st.
The metrics right here. That's my metrics.
Many governors who will actually make the decisions on whether to ease restrictions warn widespread testing needs to be a condition.
We need an unprecedented mobilization where government can produce these tests in the millions.
The goal to win against this virus is to be able to do as much testing as possible.
We don't have the amount of testing that we would like.
Mr. Trump has claimed repeatedly,
we have more tests than anybody in the world.
But the reality is, though testing capacity has improved, the U.S. trails Germany, Italy, Canada, and South Korea in testing per capita. Less than 1% of the population has been tested. Just 2.7 million diagnostic tests conducted. This week, the administration shifted responsibility for testing back to the states.
We're the federal government. We're not supposed to stand on street corners doing testing. They go to doctors, they go to hospitals, they go to the state.
Then, after pushback, reversed course and said states can choose whether to run community-based testing themselves or with federal help. The president does not accept any responsibility.
We've taken testing from a broken system that I inherited to having the best tests.
In fact, the faulty test was created this winter by the CDC.
We found that in some of the states it didn't work.
The FDA also became a roadblock, with regulatory barriers to private and public health labs conducting tests. And the government did not provide labs enough testing supplies.
We are particularly short on the test kits to be able to test for the virus.
Without a vaccine or treatment, public health officials say widespread diagnostic testing as well as antibody testing to determine if someone has had the virus and might have some immunity are required.
We still don't have good testing in place. We still are missing the widespread testing that's needed for us to understand exactly where we are on this curve.
An HHS and DHS projection leaked to the New York Times concludes if stay-at-home guidance is lifted at the end of April, the death toll could be as high as 200,000.
The one thing you don't want to do is you don't want to get out there prematurely and then wind up back in the same situation.
And as public approval of the president's handling of the crisis begins to slip, he continues to look for targets to blame.
China has been unbelievably taken advantage of us. The World WHO, World Health got it wrong. I mean, they got it very wrong. In many ways, they were wrong.
And joining me now is the Commissioner of the Food and Drug Administration, Dr. Stephen Hahn. Dr. Hahn, welcome.
And I do, like I said earlier, I do have a couple Dr. Stephen Hahn clips, the Commissioner of the FDA coming up, both from Meet the Press and also, I believe the other one, let's see, the Meet the Press Stephen Hahn clip is clip 8, but then I have Martha Raddatz talking to him, clip 10. And these are both the backward-looking and forward-looking clips. That's how I have the newsmaker clips split up. I like that Meet the Press news summary, like I said. One thing they talked about is this antibody test that I read some interesting things about, at least the Celix test, the one approved test. It has real problems in terms of the false positives. When the percentage of false positives is higher than the percentage of people in your population who have the disease, you get this weird situation where most of the people who get a positive result are false positives. It's called Bayesian analysis. It's I don't want to go into all of it, but the immunity test that, a few weeks ago I did the show on a day when I thought I might actually have the coronavirus, but I couldn't get a test. And testing still isn't widely available, despite that clip I showed weeks back. I think it was from Trump's March 6th visit to the CDC, where he said anyone who wants a test can get a test. Well, that's still not true. And in order to reopen the country, which is sort of a simplistic phrase for something that's going to be very complicated to do, there has to be enough testing to know where the outbreaks are. And that's one of the reasons that I think that the conventional wisdom might be wrong. And this curve I showed you earlier might be right, that there's going to be more outbreaks in parts of the country where we don't know there are cases. In fact, I was watching KCDC on MSNBC earlier, and in one of the Dakotas, I think it was South Dakota, they had to close down some pork processing plant because they had 80 cases. And that's what I'm talking about, like outbreaks not in the coastal epicenters. And that might be why this isn't the real peak. I don't know, but I'm just questioning the conventional wisdom. And one thing that, I talked about some of the biases that you find in the corporate news media beyond the political bias on Fox News. If you want to know about Fox News bias and why it's like a political propaganda outlet for Republicans and Donald Trump, read this book over here, The Loudest Voice in the Room by Gabriel Sherman, and you'll see that it was created by Roger Ailes for that specific purpose. And even though sometimes some journalistic things go on there, it's just political propaganda. But the rest of the corporate news media also has its own biases for sensationalism. Getting now these days that's for getting clicks or whatever, for things that get views because they have to make a profit for quite a long time now. For simplistic analysis, for both sidism, or for two-sidism, for trying to claim that there are two equal sides to issues when there's a true side and a false side. You don't give equal time to the flat earthers or whatever, but that's one of the biases of the corporate news media. And another bias that I've talked about a lot, especially when it comes to hurricanes and blackouts and weather events, they have a real bias for things that happen in New York especially, or on the East Coast or on the coasts. because that's where all the reporters are, but especially New York City, and that's been the epicenter. And that's another reason that I think that that the news media may be focusing on the New York peak rather than the national peak, and the national peak might look more like this curve I showed you at the beginning. And so that was a bias I wanted to point out in all of these news summaries, including that last one I just showed you. And now I want to move on to CNN's State of the Union, where you get kind of the same conventional wisdom from Jake Tapper, looking for signs of hope, talking about the high numbers, also talking about the economic pain and whether Trump should decide to open up the country and that he shouldn't. And I'll talk about all of that with you a little more after we watch that much shorter news summary from CNN's State of the Union this morning over here.
Hello, I'm Jake Tapper in Washington, where the state of our union is looking for signs of hope. It is Easter Sunday, but the country is still facing a dark reality. There are now more than 500,000 coronavirus cases in the United States and more than 20,000 dead. In the last 48 hours alone, the disease has taken more Americans than died on 9/11. Still, as the numbers reach almost unimaginable highs, there are some small signs that the measures that we have all been taking might be working. In New York, a state with more reported cases than any other country, the number of hospitalizations has somewhat flattened. But as the economic pain for Americans grow, President Trump is spending the holiday weekend weighing whether or not to change federal guidelines to push governors to reopen the country by May 1st. Of course, that decision to lift those restrictions lies with the states and lies with the governors. So this morning, we're going to be hearing from 3 of those leaders. But I do want to begin this morning with a vital member of President Trump's coronavirus task force, the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Dr. Fauci, happy Easter.
Now, Dr. Anthony Fauci, the clip of Jake Tapper interviewing Dr. Anthony Fauci is definitely the clip of the week. It may be the clip that gets Anthony Fauci fired, especially 25 seconds of it that I will show you over again after I show you the clip, where he basically confirms what you can read about in that New York Times story that was in the previous news summary. And you'll see Jake Tapper ask Anthony Fauci about this New York Times story. And like I said, I put a link down in the video description to the full New York Times story, which if you haven't looked at a New York Times story this month, you can look at it without a paywall, or you can actually, if you just get rid of your cookies for the New York Times website, you can also look at it for free, no matter how many times you do that, apparently. Though I subscribe to the Washington Post because I just can't bring myself to subscribe to the New York Times because of certain things that they've done that I've discussed over the years on this program, like the whole Brett Kavanaugh. I don't want to go into what my problems with the New York Times. I do want to go into this next news summary. This is from ABC's This Week with George Stephanopoulos, where I couldn't remember what Martha Raddatz's title was, like permanent guest host or whatever. No, her title is actually co-host. I listened this morning and remembered for once. So Martha Raddatz is co-host, even though she's not George Stephanopoulos, and it's not used to be like. First it was This Week with David Brinkley. I started watching the show back when it was This Week with David Brinkley. That's one of my qualifications for doing this live stream every Sunday, is that I've been watching these Sunday news analysis shows every Sunday morning, pretty much without fail, since like the 1980s, believe it or not. Some of these shows haven't even existed since then, but This Week with David Brinkley existed back then. And then for a while was This Week with Sam Donaldson and Cokie Roberts, and George Stephanopoulos took over. And I don't know why Martha Raddatz doesn't get her name in the title, but maybe it's because Stephanopoulos took up all the letters. There's just not enough room in the title for Martha Raddatz. But I don't know. Was that like anti-Greek bias on my part? But here is Martha Raddatz mentioning how Trump said 3 weeks ago, this is important, backward-looking accountability, that today was the day he wanted to open up the country to the extent he could do it. You saw Jake Tapper in that last news summary said that's actually up to the governors, which is why they talked to a bunch of governors. And I will have Governor Larry Hogan on later, but this is the Martha Raddatz news summary talking about the problems with Trump's opening up the country schedule, which I will talk about with you a little more after we watch it together over here.
Good morning and welcome to This Week. Nearly 3 weeks ago, President Trump said he hoped to have the country opened up by this Easter Sunday. But this morning, with virtual services now scheduled for this Easter morning, America has hit a grim milestone, with more than 500,000 confirmed cases of coronavirus across the country. More than 20,000 people have died. There are encouraging signs New York might be flattening the curve, but other areas across the country like Maryland and Detroit are still bracing for the surge to come. And yesterday, with the approval of Wyoming's disaster declaration, President Trump has now declared a disaster exists in all 50 states. While the president quickly pulled back on that initial Easter timeline, he now appears to have a new one. Sources telling ABC Trump is looking at reopening large sections of the country by May 1st, just a few weeks from now. When it comes to getting back to business, the president says he'll listen to his team of medical experts, but he will ultimately make that decision. So when can we reopen the country, and what would our new normal look like? Dr. Anthony Fauci says we could see an antibody test soon, which could detect immunity. How effective are those tests, and how soon will the FDA commissioner approve them for use? FDA Commissioner Dr. Stephen Hahn joins us now. Good morning, Dr. Hahn.
And I do have the Stephen Hahn clip that comes right after that about opening up the country. But she asks about the antibody test, but never talks about this Bayesian analysis thing, which I guess I'll get into a little bit briefly, which is, so say like 3% of the population has COVID-19, and you have this CellX test that I think is like 96.4% non-false positive, which means it's like 4.5% false positive rate. So if there's 3% of the population that is positive and 4.5% who are going to get a false positive based on the test, if you test 1 million people, that means you're going to get like, if you test 1 million people and 3% are positive, that's 30,000 people. But you get 45,000 people who get a false positive. So that means more people, if you get a positive, you're more likely to be in the false positive set than the actual positive set. This effect goes away, or the problem goes away, if you had like 50% of the population who were positive, had been positive or at some point for the virus. Then that 4.5% would be minuscule compared to the number of people who had real positives. But when it's just 3% of the population or whatever, but we don't even know because the testing's so bad. I saw people talking about that in the comment section about how we don't know where it is. We're basically blind to COVID-19 because of how bad our testing has been. And I'll talk about that more when I get to some of the newsmaker clips. But first I want to show you the Fox News Sunday news summary. And Chris Wallace, I was talking about the whole loudest voice in the room thing and how Fox News is a propaganda outlet. That doesn't mean that actual journalism doesn't sometimes occur on the channel. And Chris Wallace will actually sometimes perform actual journalism. And he did that when he talked to, I didn't take any clips of that interview. Was it Stephen Hahn, I think he interviewed? And no, it was someone from Johns Hopkins who he asked about the whole New York Times story and kind of cross-examined him on what a bad job Trump has been doing. And that was some actual journalism. But I didn't take that clip. But the news summary, like I've been complaining about for weeks, there's no scary graphics. There's no stat map, which you saw, I think, in 2 of the last 3 news summaries I showed you. And Fox News is known for its scary graphics And there was like briefly in the teaser, there was some map, but they spent a lot of time here, I think, spinning things. And they mentioned, Trump starting a task force, all the, positive things Trump is doing. And they certainly don't show his malignant narcissism that's been on display. Oh, and I got some super chat contributions along the way. One from Kadiff talking about COVID-19 has really made Trump's Dunning-Kruger syndrome really apparent. And I actually had forgotten about Dunning-Kruger till I saw someone else mention it earlier this week, and I Googled it, and I had heard about it before. I just had forgotten the name, and it's this basically you've heard like the saying that, real wisdom is knowing what you don't know. Well, the Dunning-Kruger effect is sort of like the psychological evidence of the opposite, that like as people get really, really incompetent, they think that they are super competent because they're so incompetent they can't see their own incompetence. And that's the effect there that I think you see from Trump. And that is not apparent at all in this Fox News summary. They're trying to make Trump look as good as possible and as, acting strongly and in control, which I will talk about with you a little more after we watch that news summary together. Wait. That was actually, well, we'll watch it. That's actually clip 6. There was the CBS News Face the Nation news summary I was going to show you first, but I spent all that time talking about Fox News Sunday that I'll go back to CBS News Face the Nation after we watch. I'll go back to clip 5 if you're following along on the clip list after we watch clip 6 together over here.
And hello again from Fox News in Washington. As millions of Americans celebrate Easter and Passover, the United States now leads the world in the number of confirmed coronavirus cases and deaths. But health officials say the worst could soon be over, predicting we'll hit a peak this weekend. And President Trump says he'll launch a new task force this week focused on when to start reopening the country. In a moment, we'll speak with a top public health expert, Dr. Tom Inglesby, director of the Johns Hopkins Center for Health Security. But first, let's bring in David Spunt, reporting from the White House, with the latest on the health battle the nation is still fighting.
Chris, for the first time in history, there is a presidential disaster declaration in every U.S. state. Today, Easter Sunday, was the day the president hoped to open the economy. But the science shows, Chris, we are still weeks away.
And here we are.
On the front lines, it's a race against time to flatten the curve.
You walked in and it was just, there were patients everywhere, sick patients everywhere. Helpless is a good word, and sad is correct.
I'm about to enter the hospital. I guess when I left my house today, I sort of had mixed feelings.
Friday marked the first time the United States crossed the 2,000 coronavirus death mark in one day. Workers lowered the bodies of unclaimed coronavirus victims into the ground on New York's Hart Island. New York State alone has more cases than any other country in the world, but social distancing is helping.
What we're doing is working, stay with it, even though it is a grind.
But more hotspots are beginning to appear in the Philadelphia, Chicago, and Washington, D.C. areas. Michigan Governor Gretchen Whitmer signed a strict executive order barring travel between residences.
All public and private gatherings of any size are prohibited.
Millions of relief checks are on their way to the bank accounts of anxious Americans. President Trump is considering opening the economy on May 1st, a day after dozens of stay-at-home orders expire across the country.
There's no happy talk, Jim. This is the real deal. And I've got to make the biggest decision of my life.
The New York Times is reporting the president ignored early warning signs about the virus in January and February. The White House released a statement to Fox News touting his accomplishments to help the American people. President Trump, in 2 days on Tuesday, will announce a bipartisan commission to help reopen the economy. Chris.
They emphasize New York Times story that claims that Trump ignored warnings. That is like the one piece of news that snuck in there that isn't positive for Trump, but they, of course, totally covered it with the White House statement touting his accomplishments and talking. I believe if you watch David Spunt's report there's 2 mentions of this task force to reopen the economy. And one thing that I thought was good about that Fox News report that's also true about the CBS News Face the Nation news summary I'm about to show you is that it got a little bit out of the coastal bubble. There was a little bit of reporting of some of these other possible hotspots, which, like I said, supports this Morgan Stanley curve I found on Twitter earlier, that the coastal peak may not be the final United States peak. I mean, that's one of the things only time will tell, but when you watch the newsmaker clips coming up, none of them deny that this may or may not be the peak. They're also saying only time and the data will tell. And anyway, this last news summary, and this is clip 5 after clip 6. Like I said before, I showed clip 6 by mistake out of order. CBS News' Face the Nation is, sometimes I've called it Fox News Light, because they do have kind of a more conservative spin. Although all the corporate, some people talk about the liberal news media, but corporations are not liberal. Big, huge transnational corporations, like the ones that own all of these news channels, none of them are liberal. They're corporations, and they're in it for the profit, and they're very pro-business because they are huge conglomerate businesses. And anyway, I just wanted to mention that before I show the... I was saying that CBS News' Face the Nation I sometimes call Fox News Light, because they are closest to Fox News in the way that they report the news, but they're not, a propaganda outlet like Fox News. I don't know why CBS has drifted that way after watching Face the Nation for also since at least the 1980s. And I think in this clip you can see that they don't have any of the scary graphics about the spread of the deaths from coronavirus, but they have some scary graphics at the end about the business consequences, which is something I've criticized Fox News for before, and that's sort of the big tension on the reopening of the government. Are we going to prioritize the health of the citizenry, or are we going to be like Lieutenant Governor of Texas Dan Patrick and Britt Hume, the senior political analyst on Fox News, who both went on Tucker Carlson and said, some of the old people should probably be willing to die for the economy. It's like Ayn Rand gone amok or whatever. I don't want to go into all that, but I've talked about it for the last several weeks, and that is some of the bias. Even though there's scary graphics about the economy, it is definitely, the scary part seems to be more economic, and the CBS News Face the Nation news summary over here, that on the good side does also go out of the coastal bubble and talk about some of the other places. In fact, there's a short introduction from Margaret Brennan, and then they go to Mark Strassman, who is in Atlanta, where the CDC is, and he talks about other areas of the country in this clip.
Welcome to Face the Nation. It's Easter Sunday and the 4th day of Passover. Americans have endured what officials had predicted to be a devastating week. This country and the world continue to struggle with the spread of the coronavirus and how to prepare for what's next. We begin our coverage with CBS News national correspondent Mark Strassman.
Good morning, Margaret. For many spiritual Americans, this Easter Sunday and the 4th day of Passover is a test of faith. Living with this pandemic for weeks has them rattled for their health and for their lifestyle. In New York, nearly 800 people a day have been dying from COVID-19, a staggering number. That level of sorrow may continue this week. Unthinkably, bodies go unclaimed. Many more may be buried in this potter's field in the Bronx. But what's encouraging, New York's new hospitalizations for viral patients have declined. This pandemic spread here has slowed.
The curve of the increase is continuing to flatten. The number of hospitalizations appears to have hit an apex, and the apex appears to be a plateau.
It's a curve that's flattening, but also broadening. Denver's building a military field hospital in its convention center. Its new COVID-19 cases have almost doubled in the last week. just like new cases in cities like Chicago and Washington, D.C. They've more than doubled in Miami, Philadelphia, and Baltimore.
This is going to be one of our most dangerous times ever this weekend and over the next week or so. This will be the worst possible time for people to be violating executive orders and to be congregating together.
Here's your canned foods here.
Families are congregating in food banks, a new front line in America's other contagion, unemployment.
I don't want my kids to starve, so I'll starve before my kids do.
The scale of the need is arena-sized from Los Angeles to Pittsburgh. People waited hours for 25 pounds of food. 10,000 families jammed bumper to bumper in San Antonio. And look again at the lines in California. In 3 weeks, the state has lost more than 2 million jobs.
I lost my job, so this is a great place to be and help out, give out food.
In masked Miami, jobless people ignored social distancing to file for unemployment. America has lost 16.8 million jobs in 3 weeks. That's roughly 11% of the U.S. workforce, and greater than all the jobs gained in the past 6 years. New unemployment numbers out this Thursday will add to the misery. No wonder homeowners can't pay mortgages. In 1 month, the national forbearance rate has spiked almost 1,000%. The good news for millions of Americans, the IRS has begun direct depositing up to $1,200 in their bank accounts. It's federal relief money, and the first recipients got theirs yesterday. This Atlanta Baptist church behind me has 2,200 members. Its 2 online services today will offer an Easter message that's timely in this crisis: the triumph of hope. Margaret?
That's Mark Strassman reporting from Atlanta. We want to go now to CBS.
I don't know about... I stopped that a little early. I actually had the clip play through where they go to Elizabeth Palmer, who, unlike any of the other news outlets, CBS News' Face the Nation did a report of what's happening in the rest of the world, not just the United States. And Elizabeth Palmer is in London and talks about various other places in the world where things are happening. So, and if you go to the link to CBS News' Face the Nation that I put down in the video description, it goes to their YouTube channel where pretty much the entire program is cut into segment videos. So you can watch Elizabeth Palmer's report, I'm pretty sure, just by going down there if you want to see what's going on in the rest of the world, not just I have to admit that I have a U.S.-centric point of view. I just criticize the corporate news media for having a coastal and New York especially centric view of things, and that may be contributing to seeing the New York peak as the U.S. peak when it might not be true. And especially, do you see that video from Florida where all these people are lining up right next to each other for unemployment claims? And if you've been watching the news out of Florida, there was all those spring breakers a few weeks ago, and just this last week, their idiot governor Ron DeSantis claimed that no one under 20, or was it 25, has died of COVID-19 in the United States, which was completely untrue. And he had to walk it back and say, oh, I meant just in Florida. And it's a completely irresponsible thing for a public official to say. And I can't imagine there won't be some bigger outbreak in Florida before this is all over. Never mind some of the other red states where they have... it seems like the fact that the social distancing and stay-at-home orders have suppressed the outbreak and flattened the curve, as they say, that there are these 2 different narratives coming out of that. On the left, people are saying, it's working, we're doing the right thing. Or, as Anthony Fauci even has said, we have to press on the accelerator and keep going. And the lower death rate prediction of 60,000 now is from the IHME model. And that's the, I didn't even know what IHME stood for till this week. And it's the Institute for Health Metrics and Evaluation, which is, I think, at University of Washington. I'm going to have a clip of Christopher Murray from, that's clip number 11, the second to last clip, talking about the IHME model. And the whole reason that's coming down is based on the idea that we're going to do this social distancing and stay-at-home orders all the way through the end of May. And it looks like our president's not going to do that. Anyway, I pretty much pre-criticized that CBS News Face the Nation clip before I showed it. I talked about what was good about it, what was bad about it, and now I want to get to the clip of the week. This is Anthony Fauci talking to Jake Tapper on CNN's State of the Union, where you'll see Jake Tapper first talks about U.S. versus South Korea, which is one of the things I've and many people have been talking about for weeks, because the United States and South Korea, I've heard it as like January 19th, 20th, or 21st, but somewhere 19th, 20th, 21st of January, both the United States and South Korea got their first confirmed cases, but South Korea did such a better job of containing and testing, and as the New York Times article, and this is one of my backward-looking clips, as to the failures of the Trump administration. And I mentioned that I think that Anthony Fauci might get fired for what he says here at just 25 seconds near the end, where he admits if Trump had acted when the New York Times says he had warnings, ample warnings, in February instead of March, many lives could have been saved. It's a logical, reasonable thing to say, and I will talk about that a little more after we watch Jake Tapper getting that answer out of Anthony Fauci, the very respected director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health, in this clip.
South Korea and the U.S. announced their first confirmed coronavirus cases at virtually the same time in late January. If you take a look at where we are right now in the U.S. now has 50 times more cases and almost 100 times more fatalities than South Korea. Meanwhile, while the U.S. makes up only about 4.25% of the world's population, the U.S. has 30% of the world's reported coronavirus cases and almost 20% of the reported coronavirus deaths. Sanjay Gupta said this is all because we got started too late in the U.S. Is that right? Do you agree?
You know, it isn't as simple as that, Jake. I'm sorry. I mean, to just say this is all happening because we got started too late. Obviously, if you look, could you have done something a little bit earlier? Would it have had an impact? Obviously. But where we are right now is the result of a number of factors. The size of the country, the heterogeneity of the country. I think it's a little bit unfair to compare us to South Korea, where they had an outbreak in Daegu and they had the capability of immediately, essentially, shutting it off completely in a way that we may not have been able to do in this country. So obviously, it would have been nice if we had a better head start, but I don't think you could say that we are where we are right now because of one factor. It's very complicated, Jake.
The New York Times reported yesterday that you and other top officials wanted to recommend social and physical distancing guidelines to President Trump as far back as the third week of February, but the administration didn't announce such guidelines to the American public until March 16th, almost a month later. Why?
You know, Jake, as I've said many times, we look at it from a pure health standpoint. We make a recommendation. Often the recommendation is taken. Sometimes it's not. But it is what it is. We are where we are right now.
Do you think lives could have been saved if social distancing, physical distancing, stay-at-home measures had started third week of February instead of mid-March?
You know, Jake, again, it's the what would have, what could have. It's very difficult to go back and say that. I mean, obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated. But you're right. I mean, obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
Do you think it will be safe in November for voters?
And I kept that clip playing because you see Jake Tapper did a great job of getting that admission out of Dr. Anthony Fauci in that clip, but he didn't follow up on what he said there at the end, that there was great pushback. And what I want to know is who was doing that great pushback? And there's some reporting from the Washington Post, I didn't put that article down in the video description, that Trump was one of the ones who was saying, well, why don't we just ride this out, get the herd immunity, let it sweep through the population, or I'm not getting the quote exactly right. And then Anthony Fauci pushed back on that. That was a Washington Post story, but I wish Jake Tapper had done at least one more follow-up asking who was doing the pushback against this recommendation that we shut things down almost a month earlier. But kudos to Jake Tapper from getting that answer out of Anthony Fauci that, like I said, might get him fired. And I have 24 seconds of that last clip that I will be very surprised if you don't see it going into November. I mean, I think what Trump is... One of the things I'm not really talking about in this live stream is the big news this week that was really only covered in the pundit discussion section of the news analysis programs, that Biden has wrapped up the nomination. Bernie Sanders dropped out. Joe Biden is going to be the Democratic nominee running against Trump, and assuming he's still alive in November, which seems likely. And that I actually been thinking I might make some separate video about that, like Trump versus Biden, and talking about what I think about that, but I'm not covering it today. But my point is, I think that some point when the Biden versus Trump campaign actually starts happening, you will be seeing some of that last clip from Anthony Fauci, possibly. I've taken out the 24 seconds that I think may be appearing later in ads showing Trump's malfeasance in office as a leader in the COVID-19 crisis because of what Anthony Fauci said in the 24 seconds of that last clip that I've excerpted to talk about with you a little more after we watch it together over here.
Obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated. But you're right. I mean, obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
A lot of pushback. Who was doing the pushback? I think we know who was doing the pushback. But hopefully Anthony Fauci will not get fired. But I don't know. I've been wondering when he's going to get fired for weeks now. And that seems to be something that might be a fireable offense in the Trump administration, which is all about loyalty rather than competence. And that's one of the reasons we're in the predicament we're in at this moment. But I want to move on to one more backward-looking clip. Wait, this is Chuck Todd talking to Stephen Hahn, Dr. Stephen Hahn, the commissioner of the Federal Drug Administration, the FDA, asking if there is a plan and asking about the Red Dawn email. They're calling it the Red Dawn emails. There are 8 emails in the New York Times story that show that Trump was warned over and over again about this coming crisis and didn't want to believe it. They tried the Secretary of HHS, Alex Azar, tried multiple times to get his attention. And there are all these emails, and 8 of them are in the New York Times story, and you can see This is I think this might be the last backwards looking clip before I get to the, oh no, there's one more backward looking clip from Governor Larry Hogan coming up, and then I'll go to the forward looking clips about whether we're at the peak. But here is Dr. Stephen Hahn, the commissioner of the FDA, talking to Chuck Todd on NBC News' Meet the Press about this New York Times story and whether Trump was warned, and you don't really get a denial, as I will talk about with you a little more after we watch that clip together over here.
Fairly new into this position. Did you ever go through one of these pandemic exercises that the government, were you there the last time a pandemic exercise had taken place?
No, I wasn't. I was confirmed in December and started in late December, Chuck.
Do you feel as if, in hindsight, did you have enough people around you that had gone through this? I want to read you one email, and I know you want to look, you say that eventually you want to look backwards, but right now you don't. But I got to read you this very detailed New York Times story, one leaked email from the Red Dawn email exchange that I don't know if you were on some of this, but he said this: "We are making every misstep leaders initially made in tabletops at the outset of pandemic planning in 2006. We had systematically addressed all of these and had a plan that would work and had worked in Hong Kong and Singapore. We have thrown 15 years of institutional learning out the window and are making decisions based on intuition." Do you feel like you had enough institutional knowledge to deal with this pandemic?
So I'm not aware of that email. What I can tell you is I do feel that we've been surrounded by experts, particularly at FDA. We have a lot of scientific and clinical experts who know a lot about testing. So I do feel that there has been the appropriate expertise to help us get the tests, at least initially, where we need to be. And then obviously we have responded to the changing situation and changed our regulatory approach based upon that.
Have you felt pressure, though, political pressure from toning down, sounding alarms? I mean, there's a lot of implications that some in the White House, the president himself, didn't like the sounding of alarms that was taking place about this virus over the last 6 weeks. Have you felt that pressure?
Chuck, I have not felt political pressure. I have not exerted political pressure on FDA. Where we do feel pressure is on the urgency of the situation. You pointed that out earlier in this conversation, and I think that's right. This is a rapidly moving, it's a novel coronavirus, and we have had to respond to that as information has come into us. So there is an urgency around this, but I have not received political pressure to have FDA make one decision versus another.
I know you are going to be approving.
So, yeah, there's Dr. Stephen Hahn of the FDA saying that he hasn't received or exerted political pressure, but when it comes to the Red Dawn emails reported in that New York Times article that there's a link down in the video description as to the warnings that Trump missed. Well, Stephen Hahn luckily just came on board at the FDA in December, so he knows nothing, he sees nothing, he doesn't have to be accountable for anything that is in that article. Like I said, I have one more backward-looking clip, and then I have 3 forward-looking clips, including a Dr. Stephen Hahn clip about, you know, are we at the peak, and when do we have the ability to reopen the country, as Trump likes to say. But before I get to that, I have a Republican governor. This is the Republican governor of Maryland, Larry Hogan, over on ABC's This Week with George Stephanopoulos, talking to the Untitled co-host Martha Raddatz about one of the other misstatements, lies, whatever you want to call them, Trump has made in his news conferences, where he won't in any way confront reality. They're basically, the whole point of the news conference is try to change reality through the force of his personality, such as it is. And here you have Larry Hogan, Republican governor of Maryland, basically confirming that when Trump says all the government, and Larry Hogan is the head of the Governors Association, so he is like speaker of all the governors, and he will not back up Trump's claim that all the governors are happy and they're all getting everything they want, as I will talk about with you a little more after we watch that ABC clip together over here.
You say that you and many other states are in dire need of more supplies, but listen to what President Trump said on Friday about the needs of the governors.
We're in great shape with ventilators. We're in great shape with protective clothing. We have additional plane loads coming in, but we're not getting any calls from governors at this moment. We're getting very few calls from governors or anybody else needing anything.
You are chair of the National Governors Association. Is that true?
Well, I get calls from governors every single day. We've had 12 calls now with every single governor in America, 8 of which the president and or vice president was on the call with us. And I can tell you that nearly every single governor, I had a call with the FEMA administrator just yesterday afternoon. Look, I think that we've certainly seen an improvement over the past week from the week before. I know that a lot of people in Washington are working very hard. Everybody has gotten more supplies than we had the week before and the day before. And I know there's people in Washington that are working very hard as partners to try to help the states. But I think to say that everybody's completely happy and that we have everything we need is not quite accurate. I mean, everybody still has tremendous needs on personal protective equipment and ventilators and all of these things that you keep hearing about. Everybody's fighting to find these things all over the nation and all over the world.
And the administration is launching a second economic task force.
So, like I said before, I showed the clip, even the Republican governor of Maryland, Larry Hogan, couldn't back up the misinformation, lies, whatever you want to call it, from Donald Trump about all the governors being happy, about them all getting the tests and the PPE and, personal protective equipment and the ventilators, that nobody's asking for more and nobody's complaining about Trump. And Trump has really been setting up to blame the states, as I talked about last week, and then this last week he's also added the World Health Organization as one of his scapegoats as to where he's going to try to shift the blame from all of his own blameworthy activity that, like I said, was outlined in this New York Times article this morning. That this is a screenshot of the headline, but I put a link down in the video description to that article if you want to read it for yourself. Now I actually want to move on to those last 3 forward-looking clips that are more about whether we are now at the peak or and whether we can reopen the economy at this point. And it has to do with that other image I've been showing you of this alternate forecast that is different from the conventional wisdom you just saw from all the corporate news media that we're at the peak. And all these people, these next 3 people are first Stephen Hahn from the FDA, and then Christopher Murray from the IHME model, the Institute of Health Metrics and Evaluation at the University of Washington, that you hear so much about, the IHME model. Well, the director of the IHME is the second clip I'm going to show you, and then the final clip is from the mayor of Washington, D.C., saying Washington, D.C. is going to have their peak of their curve is going to be in June, which again supports this other places other than New York City and the West Coast are having their peaks at a later time. So the U.S. may have a peak at a later time. But here is first Dr. Stephen Hahn of the FDA talking to Martha Raddatz about, when are we going to be able to reopen, and are we ready for what we need to do, and is this the peak? And I will talk about that a little more after we watch that clip together over here.
I want to start with the latest models, which are projecting that the U.S. peak in terms of daily deaths would likely be today. The president citing models that he said show Easter as hitting the top of the curve and then starting to come down. Have we peaked, and does this mean the worst may have passed?
Martha, thank you for having me on the show. The models do show that we are very close to the peak, and so I think that information is accurate. This has been a very fast-moving outbreak, and so we really have to take this day by day. We have some of the best experts in the world, Dr. Fauci, Dr. Birx on this, and so I think that information is accurate. But again, we have to take this day by day as the data come in, because this has to be a data-driven approach.
And of course, the president had initially set today as a target date for reopening the country. He backed off of that. But there are new warning signs about opening the country even by May 1st. The New York Times obtained new federal projections showing a spike in infections if restrictions are lifted. And the model the White House often cites predicts a death toll of 60,000 only if full social distancing is kept in place through the end of May. So wouldn't we be taking a big risk relaxing those measures now?
Those are obviously the issues that are going into the assessment of when is the right time to go back. Martha, I think the public safety and the welfare of the American people has to come first. That's been the constant message from the president, the vice president, and within the task force itself. So that has to ultimately drive these decisions. There are obviously other considerations. I've heard from friends and colleagues around the world that people really do want to get back to a more normal life than what we've had the last several weeks. But we've got to get the data as they come in. We have to look at what we know about this illness, what's happened in other countries, and put them into the situation, to the plan moving forward.
So given what you know, given what you know, is May 1st.
And you can watch the rest of that interview at a link down in the video description to ABC's This Week with George Stephanopoulos if you want to see the rest of Dr. Stephen Hahn's answers. But you didn't really get an answer to the question there. It was a lot of hedging and waiting for the data, and it seems like the smart people who are advising Trump, the doctors, and Stephen Hahn is a political appointee, but he is a doctor, and you saw in Anthony Fauci's answer earlier and if you read the reporting from the New York Times and the Washington Post, it seems like there's a real struggle going on in the Trump administration between the health professionals and the, Ayn Randian social Darwinist and Trump himself, who wants to, ride it out like a cowboy. That's what he said. Ride it out like a cowboy that was a real thing he said in one of his press conferences, as to, some people said, and even one of his press conferences, he admitted he was one of the people who said, ride it out like a cowboy, or not ride it out like a cowboy, but, who wanted to, just ride it out. And I kind of worried that that Trump might lean too far in that direction. Even the models that they're looking at that are looking better actually assume that all these stay-at-home and social distancing orders remain in place through May. That's the IHME model, and the director of the IHME, as I promised, is answering a question in this next clip from Margaret Brennan on CBS News' Face the Nation, both about when he thinks it'll be okay to open, and then, why has the IHME model changed? This is Dr. Christopher Murray from the state of Washington, and I will talk about that a little more after we watch that penultimate newsmaker clip before the bonus Dash and Sandy clip, the dandy clip, as it were, at the end of the show. But here's the penultimate newsmaker clip that I will talk about with you after we watch it together over here.
One of the models that the White House is watching closely in terms of hospital resources and what the death toll could look like going forward is from the University of Washington's Institute for Health Metrics and Evaluation. You often hear it referred to as the IHME model. The director is Dr. Christopher Murray, and he joins us this morning from Seattle. Dr. Murray, good to have you here. What would a rolling reopening of the economy look like, and what would that do to your projections?
Well, we've been trying to investigate that because I think the issue is if you open up too soon and there's a big load of cases still in the community that have the potential to go back to community transmission, we can quickly see resurgences in some states. So some states, it's possible in May, but in other states, it's going to be very unlikely that would not lead to an immediate resurgence.
Which states are safe to reopen?
Well, what we're seeing is that the states, such as out here on the West Coast, seem to be farther along the epidemic, peaking, and then we need multiple weeks of closures after that peak to bring the burden of cases down to the point where testing and contact tracing has a chance of working. And then, of course, there's the big issue if states are on different timings of their epidemics, which we know is the case. How are they going to control importation from other states into their state? So it poses a whole series of new questions that haven't yet really been addressed.
You know, this week your model projected that around 61,000 Americans will lose their life to the virus by the end of this summer. That is a breathtaking number, but it is far lower than your April 2nd estimate of nearly 100,000. Your discrepancy there has been heavily criticized. I'd like you to explain why there was such a significant change.
Well, about 2 weeks ago, our first prediction was about 80,000 cases with a very wide range from about 30,000 to 150,000. And all of our subsequent forecasts have been within that range. What the advantage of the model that we run, which is we keep updating it, 3-4 times a week, is that it's driven by the data. And so the trend up in some states has been faster. In New York, for example, at the beginning, that pushed our forecasts up. And then the trend, the peaks that we're seeing in California and Washington have been lower than expected. And that's brought these forecasts down a bit. But they've all been within the same range. We're now, the last series of forecasts have been around 61,000 deaths. We predicted the peak about now, and that seems to be occurring at the national level. But because of incomplete implementation of social distancing closures in many states, it's adding a degree of uncertainty about what's actually going to happen in places like Texas, as an example.
Texas is a hotspot that worries you still?
Well, all the places where we have only partial closures, for example, on the essential business list, those are the ones that it's really much harder to know what's going to happen. Okay. We have rock solid evidence that the full closures work. We've seen that in Italy and Spain. We're seeing that out here, out west. But what we don't know is, do these sort of incomplete closures have the same impact?
You know, Dr. Fauci likes to say that among.
So there you have the director of IHME explaining the IHME model and why it's changing, and also saying that they have incomplete information about how these partial closures, I was showing you, talking about the people all lining up together in Florida and the bad information in Florida, and these 80 workers in South Dakota, and Arkansas doesn't have a full stay-at-home order. There are all these red states where, like I was saying, there's this alternate narrative in the right-wing media that that the fact that the death forecasts are coming down means this whole thing was overblown. It was media hype, rather than they're coming down like Dr. Christopher Murray said in that last clip. It's coming down because mitigation efforts, the social distancing, the stay-at-home orders are working, and it was always within a range, and for some period of time, the places where the worst outbreaks were or are doing a good job, but that doesn't mean that it can't get worse in other places later, which is this later peaking curve I've been talking about throughout the broadcast. And the final news clip I want to show you is the mayor of Washington, D.C., Muriel Bowser, talking to Chris Wallace on Fox News Sunday this morning talking about how Washington, D.C. is planning on a June peak. Not now. This is not the peak, at least not for Washington, D.C., and who knows where else, especially with the problems with the testing. Nobody really knows. That's why I'm not saying that this Morgan Stanley curve that I've been showing, that's the way things are going to happen. I'm just saying that this conventional wisdom that we're at the peak right now, I don't have confidence in that conventional wisdom. And I think it might be part of the corporate news media bias for New York being the world, but I might be wrong. I just wanted to point out that possibility. And this final news clip with the mayor of Washington, D.C., Muriel Bowser, talking about a June peak there kind of backs up my suspicions, as I will talk about with you a little more after we watch this final news clip from Fox News Sunday this morning together over here.
While national attention has focused on the epicenter of the coronavirus crisis in New York, health officials are tracking the next potential cities to get hit hard, including the nation's capital. So far, Washington has seen more than 1,700 cases and 47 deaths. And joining us now, D.C. Mayor Muriel Bowser. Mayor, national public health officials keep talking about Washington as the next potential hotspot, and you said that you worry that Washington could be in the second wave of virus outbreaks. So what is it that you're seeing that worries you?
Well, certainly, Chris, we are getting prepared, and we, like all cities and states around the country, are looking at various models to see what they tell us about when our medical surge will happen. And we expect that that could happen in Washington, D.C. in June. Our residents are doing everything that we ask so that we can push down the number of peak cases and push out when that surge would happen in D.C.
I want to pick up on what you just said, because you are working off a model that says that Washington is going to hit its peak not in April, as New York is now, or even May, but in late June. Why so late in Washington?
Well, we think that all of the interventions that we put in place very aggressively in the early part of March, closing our schools, shutting down our bars and restaurants, closing essential businesses in Washington, D.C., has pushed out when the peak might occur. And we just know, we see that in a number that there are cities who are experiencing a surge in cases and hospitalizations now, and we know and we see from what we see on the ground and testing show that our peak will come later.
Meanwhile, it's not just a health crisis.
So there you have it. At least one government official, the mayor of Washington, D.C., Muriel Bowser, confirming that there may be a later peak to the coronavirus, at least in Washington, D.C., and who knows if it's going to peak later in Detroit or New Orleans or South Dakota. There's this outbreak that I saw when I was watching KCDC earlier, as I was talking about. And anyway, so I think you saw a lot of substantiation of the New York Times article, that the backward-looking topic I was talking about Trump ignoring warnings that could have saved lives, and especially that clip of Anthony Fauci pretty much confirming in a way that could be used against Trump in the election. And then some questioning of the conventional wisdom that we're at the peak right now, that this is the U.S. peak when it may be the coastal peak, but I'm not vouching for this Morgan Stanley forecast. I'm just showing it as an alternative possibility to the conventional wisdom, especially because we have such problems with the testing. We're blinded by our lack of information, which is a result kind of that backward-looking problem that is the first topic. So anyway, those are the issues I wanted to discuss with you in my Sunday live clip roundup. I also want to thank those of you who contributed through the super chat function during the show. I took a little screen capture a minute or two ago. Here we go. Ooh, a double contribution from Sexy Bob, and I think I answered that question about the... I think there are no questions left to answer. Let me look about the Dunning-Kruger. I think I said Kroger. I got multiple corrections on saying Kroger instead of Kruger, but yeah, the Dunning-Kruger syndrome. And Kettle says Fauci won't be fired. He'll be replaced with the Great Opening Task Force. Well, I think however Trump gets rid of Fauci, if that happens, that will be a big news story, even though there are so many big news stories these days. And I also want to thank those people who support my videos. I don't get much ad revenue from YouTube. I think some of my COVID-19 live streams have been monetized like 2 days after the live stream, after everyone's watched it or whatever. So the super chat contributions are really helpful. If there's a join button below the video on YouTube. I've gotten a bunch of I think channel members that also help when there's no ad revenue. And of course my Patreon contributors, there's a link to Patreon down in the video description, and direct PayPal contributions. And for Patreon and PayPal, if you give a $5 contribution, I send you, and give me your shipping address, I send you one of these weatherproof vinyl #LiberalViewer stickers. And at the $10 level, you get the sticker plus this wonderful Constitution. And if you read it, you'll know more than our president, Donald Trump. And if you click on the join button, there are other levels, because YouTube takes a much bigger percentage than PayPal or Patreon. But anyway, before I finish up, I want to show a bonus Dash and Sandy clip, the Dandy clip, for those who like to call Dash and Sandy Dandy as some sort of, what is that, a portman or whatever. I don't know what you call that conglomeration of names when you like the Benifer, when Ben Affleck or J-Lo, or I don't know what you call those couple conglomerations, but actually Dash and Sandy don't interact that much, and I was just able to briefly capture some Dash and Sandy interaction, and I believe there's a brief mew from Dash the cat when boldly passing by Sandy in this clip. And if you listen carefully, in the background of that clip, you will hear KCDC, which airs between 4 and 6 p.m. Pacific time, right before I started the show. That's the way you can verify it's not some staged Dash and Sandy clip from the past. That actually happened today when KCDC was broadcasting on MSNBC. So anyway, that is the final clip. Like I said, I've been thinking about doing a video about Trump versus Biden. Let me know down in the comment section, especially if you've watched all the way till the end, so you're a real loyal fan. So if you're answering questions I ask, what are we at, like an hour and 23 minutes or so into this video? If you're still watching after an hour and 23 minutes, I really want to hear your opinion on, should I do a extra video about Trump versus Biden now that Bernie Sanders has dropped out? And then I actually have some other ideas for pandemic videos that I might talk about next week. But I will be back next week. Maybe I'll have some reason to upload some other video like that Trump versus Biden video I just asked about. But if not, I will be back next week and every week for at least for the rest of 2020 through the election. That is as much as I can definitely promise, and well, assuming I survive and we all survive the, real, the real wave that the zombie apocalypse, I've been watching all these zombie apocalypse movies and TV shows and various other forms of that genre, and it seems we're in like the reality show version with Trump as our host, and I have to say I'm not really enjoying this season. You can let me know what you think down in the comment section, and I guess that is a good place as any to end the program. So until next week, or until I have some other reason to upload a video, I guess I will be seeing all of you around the internet.